Okay, about the peritoneum. This is the diaphragm. Below it, we have the peritoneum. This is the diaphragmatic part of the peritoneum. It continues downward anterolaterally. Continues as the urogenital peritoneum. Doesn't cover all the urogenital organs, just drapes over them like that. And this is the paravesical part of the peritoneum, which is between the bladder and the anterior walls of the pelvis. This is the mesentery. As you can see, it is supporting the uterus. On here, we have a pararectal fossa which supports the rectum. Also, one part is the suspensory ligament of the ovary. Now, after looping around the pelvis, we go back up. Was the parietal peritoneum that we discussed, down anterolaterally covering all the pelvic organs. Essentially, all the parietal peritoneum is doing is lining the internal surface of the abdominal wall pelvic organs. Seri, இப்போ tricky part வருது, pay attention. So how does this parietal peritoneum continue as a visceral peritoneum? Comes to the surface of the liver. The liver ஓட front side ல இருந்து வரந்து joins the falciform ligament. From above it joins the right and left coronary ligament. If you look at the back side of the liver, it is joining the left and the right triangular ligament. All this green parietal peritoneum is joined now. And then it will continue over the liver as the visceral peritoneum. Then it goes under the liver and then continues over the other organs. See, tension mat lena, I will show you again. See, the parietal peritoneum is coming from under the liver and then it is joining all your ligaments. Which are the ligaments? The falciform ligament anteriorly, the right and left coronary ligament. पीछे से देखा तो you have the right and left triangular ligament. All this you have to imagine is where the parietal peritoneum is joining with the visceral. Right, it's continuing as a visceral over the surface of the liver. Then it continues as the visceral peritoneum under the surface of the liver. So through some ligaments it joins. So below the liver first you have the hepatogastric ligament and then the hepatoduodenal ligament. It's just joining the inferior surface of the liver to the lesser curvature. Know that all these ligaments under the surface of the liver are called the lesser omentum. So now focus on the hepatogastric ligament which is coming anteriorly and posteriorly. Covers the stomach so that we have two layers at the greater curvature of the stomach. Understand that this part is the greater curvature of the stomach. Now these two layers as they are going to go down and they are going to loop up and form four layers now, which forms the greater omentum. Before that, remember that the same hepatogastric ligament that was covering the stomach from the front and back is also giving out a ligament, a gastrophrenic ligament to the diaphragm, gastrosplenic ligament, the spleen. But most important is how it connects to the transverse colon below. It does not go directly. Seri, puriyada. Inferior to the liver, we have the hepatogastric ligament in green, loops over the stomach, both sides, gives gastrophrenic and gastrosplenic. Like I told you, it first forms the greater omentum per se. Omentum comes and joins the tinea. It's called the omental tinea. Covers the transverse colon, ends at another mesocolic tinea. And the fun part, this continues as the transverse mesocolon, which fun fact is also known as the mesentery. See, these are the pancreas and the duodenum. The mesentery just connects the colon to the posterior abdominal wall and the retroperitoneal organs. This part where it joins the posterior abdominal wall is called the root of the same point, by the way, which gives coverings to each of the small intestine loops. And they all meet here at the root of the mesentery. This root starts at the level of the second lumbar vertebrae. You can see that level here. This is L2. Now remember, intraperitoneal means all the organs that are covered completely by the visceral peritoneum, which includes the stomach, the spleen, cecum and the appendix, transverse colon, sigmoid colon, along with the upper part of the rectum, entire jejunum and ileum. We have mesoperitoneal, 3/4 of which are covered by visceral peritoneum and the rest is parietal peritoneum. Talking about the liver, gallbladder, ascending and descending colon, the middle part of the rectum. And if a full bladder comes, but if the bladder was empty, it would actually be retroperitoneal, which means only 1/4 is covered by visceral peritoneum. All your pancreas, duodenum, kidneys, of course the ureter, which lies behind the visceral peritoneum. Ending on an extremely happy note because I've never understood peritoneum like this before and I hope this helps you too. Have a good day.